The appearance of a scar often depends on how well the wound heals, so proper at-home treatment is crucial. I'm Dr. Charlie Dunn, a board-certified dermatologist, and I'm going to teach you how to properly care for your wound at home. Always keep your wound clean. Start by gently washing the area with mild soap and water to keep out germs and remove debris. Use petroleum jelly to keep the wound moist. This prevents the skin from drying out and forming a scab. Wounds with scabs take longer to heal. It also helps prevent the scab from getting too large, deep, or itchy. Since you're cleaning the wound daily, it isn't necessary to use antibacterial ointments. After treating your wound, cover it with an adhesive bandage. For large scrapes, sores, burns, or persistent redness, it may be helpful to use silicone gel or hydrogel sheets. Change the bandage daily to keep the wound clean. If you have skin that is sensitive to adhesives, try a non-adhesive gauze with paper tape. If you are using silicone gel or hydrogel sheets, make sure to follow the instructions on the package for changing the sheets. And if your injury is so bad that it requires stitches, follow your doctor's advice on how to care for the wound and when to get those stitches removed. Finally, apply sunscreen to the wound area after it is healed. Sun protection may help reduce discoloration and help the scar fade faster. Always use a broad spectrum, water-resistant sunscreen with an SPF of 30 or higher and reapply frequently. If you're worried about the appearance of a scar, partner with a board-certified dermatologist who can help.